So today we are going to discuss depression, and I'm going to discuss it in 4 parts. I'll tell you the definition and the statistics of depression. I will tell you the causes of depression. I will tell you the signs and symptoms of depression. And also I'll discuss depression in women because women are more affected by depression, and I'll tell you why. So to start with is to answer the question, what is depression? And depression is one of the commonest mental health illness that present with a persistently low, sad mood or loss of interest in things that someone used to enjoy. It affects your feelings, it affects your thoughts, it affects your ability to work, either at work, at school, at home. It impacts your relationships, it impacts almost every domain of your life. Everybody can get affected by depression, despite the age, the education status, the religious affiliation, the culture, your socioeconomic status, your race, your sex. As long as you have a mind, as long as you have a brain, no one is immune to depression. So anybody can get depression, and it affects both children and adults. If untreated, it gets worse or it lasts longer. And in the worst case scenario, it results to self-harm and to suicide. You might be wondering, why are we even talking about depression? What are the statistics of depression? The statistics of depression in the world, 332 million people in the world have been affected by depression. And depression is one of the leading cause of disability and disease burden. In women are affected 1.5 more times than men. I'll tell you why. And in adolescents, if it affects adolescents, which it does, of course, it's one of the risk factors for suicide, which is a leading cause of death between those aged 15 and 29, because it's a risk factor. Depression is a risk factor for suicide. In Kenya, when you look at Kenya, 1.9 million people have been diagnosed with depression. And out of these 1.9 million, these are the people that walks into the hospital that are diagnosed. A previous study showed that 30% of people who walk into the hospital outpatient services have a diagnosable mental health illness that needs to be treated, but they are not treated. So in Kenya, 1.9, and these statistics in Kenya, we are just number 5 in Africa. The leading country with depression in Africa is Nigeria, followed by Ethiopia, followed by Congo, South Africa, and then Kenya. So the 1.9 million cases that I'm talking about, they are the people that have been diagnosed. But we know these figures are low because not many people go to the hospital. And I'll tell you why not many people go to the hospital. Number one is the stigma that is associated with mental illnesses. Nobody wants to be told that they are mentally ill. Nobody wants to be labeled. The stigma which we have to come to talk about, because it has to stop. The low numbers of mental health specialists to diagnose and treat people can also be contributed to that figure. The fact that mental health services are not easily available. Most of them, they are available in town and urban setup. In the villages, in the rural areas, they are not there. That also can be contributing to that. And the other thing that depression might be lower than the numbers we know is because people who have depression, the way they present, they are quiet, they are isolated, they keep to themselves, they are locked up. They don't bother anyone. Unlike other diseases, the mental health diseases, where you find people screaming on the street, collecting things on the street, making noise, threatening, aggression. Depression, most of the time, doesn't have that. The people are quiet, and it can be missed. As long as you're not disturbing people, it can be missed. And that's why we need to talk about depression, because it's a leading cause of disability in the world, yet it is missed. It is not managed, and we know the consequences of untreated depression. So that is depression. And next, I'll tell you about what to look for. What are the signs and symptoms of depression? How do you know someone is depressed?